Studies covering the link between suicide and the psychodynamic theory have hypothesized that suicide attempters are more likely to have experienced loss in their childhood than in recent memory. This is known as the loss hypothesis. This is significant when one works with clients in the young and middle adulthood age range, as it may very well not be recent losses or tragedies that drove them to attempt suicide. In fact, in Dr. Caslow's theory, it was found that most suicide attempters are more likely to have experienced a loss as a child than as an adult. In an empirical study of the psychodynamics of suicide, 4 key elements involving suicide were identified. 1. Self-directed aggression. 2. Unresolved grief in response to object loss. 3. Disturbance of ego functioning. And 4. Pathological internal object relations. Moreover, according to Kohert, suicide then reflects a response to feelings of narcissistic rage, shame, or other forms of aversive self-awareness. According to Caslow's study, the majority of attempters were adults suffering from depression, anxiety disorders, substance abuse disorders, and/or adjustment disorders. In the interpersonal psychological theory, in order for one to commit suicide, they must have A, the desire, and B, the ability to do so. According to Trout, those who succeed in committing suicide are likely to have been socially isolated before their deaths. Adults who feel that they are burdening their family members has been found as a pre-indicator of suicide. In a study on undergraduate students at Florida State University who averaged an age of 19, therefore making them young adults, those who felt that they did not belong and were burdens were more likely than their counterparts who did not feel that way to ideate suicide. As aspiring social work students, it is essential to remember that suicide is preventable. In fact, 90% of those who commit suicide had a diagnosable psychiatric disorder at their time of death. Therefore, it is incumbent upon us to practice social work ethical guidelines by opening up our services to anyone who may need it. The research agenda for suicide prevention identifies 6 key questions that help reduce the nation's suicide rate. 3 are essential for social workers to know. 1. How can we better or more optimally detect and predict risk? 2. What interventions prevent individuals from engaging in suicidal behavior? And 3. What services are most effective for treating the suicidal person and preventing suicidal behavior? These are questions that if we ask, a client's chance of committing suicide is in our hands. We are able to help. According to the Code of Professional Ethics of Suicide, clinicians that work with attempters must abide by the code and principles of autonomy, beneficence, non-maleficence, and justice.